Kidney. Well, some will go in order. Kidney, they're not gonna ask you to name this organ, because it's assumed that you know this is a kidney. You might wanna know that it's retroperitoneal though. Okay, we have, surrounding the kidney, this fibrous capsule or renal capsule, take your pick, but don't just call it a capsule. Surrounding that, which we don't have on the models, would be an adipose capsule. You all know what adipose is, look at AP Revealed and CAT for adipose. So far, so good. Okay, this inlet right in here where you see the blood vessels going in and out, the ureter comes out, that's called the renal hilus. You can also call it a renal hilum, whatever you like. Regions of the kidney, am I going in order? Renal cortex is next?
Yep.
Okay, so this outer region here is the renal cortex, and this inner region is the renal medulla. Those are regions. We have structures in the renal medulla. These are renal pyramids. They kind of look like a pyramid, don't they? And the tip of the renal pyramid is called a renal papilla. So far, so good. Is minor calyx next? No, it's renal columns. Renal columns, that's extensions of the cortex between the pyramids. So we'll be right in here between our renal pyramids. That's renal columns. Now is minor calyx next?
Pelvis.
Hey, you weren't supposed to tell me that. Okay, ureter. Right in here. See how it gets kind of enlarged in this region? That's the renal pelvis. Now is major calyx?
Yep.
I guess I'm just anxious to do these calyces. I'm going to do minor first because I want to. So minor calyces start at the renal papilla. We have many renal minor calyces. Minor calyces, several of them merge to form a major calyx. And then the major calyces will merge into the renal pelvis. So this would be minor, minor. That's a minor calyx. That's a minor calyx. Minor, 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 minor. See where they merge though? That's a major.
Because there's only like 2 or 3 of them.
Exactly. Cool with the calyces. Nephron is next, the renal corpuscle and all that. All right, so we have all these Christmas ornaments, if you will. These are renal corpuscles. This is a renal corpuscle. Renal corpuscle
And
is
that's
made up of,
found where?
in the nephron.
Within the cortex?
Like right here's the nephron. Okay? We have like 1.5 million per kidney. They're microscopic. Nephrons. So this whole thing's a nephron, and we're going to start at the renal corpuscle. The renal corpuscle, this is a big one, is made up of the glomerulus, which is a ball of capillaries, and surrounding that is the Bowman's capsule or glomerular capsule, whatever you want to call it. Cool? All right.
What else is in there?
Well, nothing for lab.
Oh.
If you want, I can talk physiology.
What else is in there?
What? Ivy said yes. So, okay, so the capillaries have these teeny little slits in them called fenestrations.
Oh, okay, yeah. We talked about that Monday.
And then covering those would be the pedicels with the foot-like podocytes.
Podocytes.
So covering this would be the visceral layer, and this is the parietal layer, is Bowman's capsule, which is what type of epithelial tissue for fun?
Squamous.
What type of squamous?
Simple.
Simple squamous epithelium, good. Okay,
And then the bladder has transitional epithelium.
and then what is our tubules? Not columnar,
Cuboidal.
cuboidal. All right, enough fun. So, when you do a nephron, whatever model you're on, I want you to start here and then follow it, because they're all different. So here's the renal corpuscle,
PCT.
proximal convoluted tubule, which will then straighten out to the descending limb of the loop of Henle. Here's the ascending
The
limb.
nephron loop. It's a nephron loop.
That's fine.
Because she made that clear in lab last week. She goes, they're trying to get away from saying the loop of Henle now.
Oh, the nephron loop, but it's still the descending limb, and
Oh,
this is
yeah.
still the ascending limb.
Right.
And then we have a distal
DCT.
distal convoluted tubule. The many distal convoluted tubules will merge into one collecting duct, which then merges into a papillary duct. Look here, here's the collecting duct, and then here's the papillary duct, and surprise, surprise, it's on the renal papilla. Shocking, isn't it?
Where's the collecting? Oh, that long thing?
this long one, and then papillary duct. Cool?